Welcome to the Lister practice. My name's Christine Lister. I've been in practice as an osteopath since 1989. We treat patients here of all ages. Our youngest patients are newborn babies and our eldest patients are well into their 90s. I'm very experienced at treating people of all ages, and it's interesting that at different times in life people will present with different problems. Newborn babies, for example, will often present for digestive problems, general restlessness, difficulty sleeping, and later on children, when they're going through a growth spurt, may get problems where they're growing up too quickly and they're not broadening out with enough muscle, so they get problems with this rapid growth spurt and not enough muscular support, and we see quite a lot of joint strains in the spine at that time. And also during that time in childhood, kids can be susceptible to problems with knees, also associated with growing difficulties, and sometimes we get neck problems when kids are jumping around at sports and doing the sort of things that kids do, causing them to sprain a joint or have some kind of problem with the neck or lower back. Young adults will often come in with problems associated with work. So that often starts with A-levels and lots of studying, poring over books and bad postures. So we do quite a lot of work with postural advice and therapeutic exercise as well. Young adults don't tend to get so many of the degenerative problems, although there will be a group of people coming in who may get inflammatory rheumatological conditions, and sometimes we're able to help some of the symptoms, and sometimes these people will need referring on to a specialist. Moving on into the middle years, the sorts of problems we get then are the ongoing overuse problems associated with occupation, people who spend a lot of time at the computer, people who carry things a lot, builders, plumbers, people who have to get into difficult positions for their work and so forth. And then we start to see the onset of early degenerative change. And it's not just the treatment we do for these patients that helps them so much, but it's the advice we give. Older people are very susceptible to having falls. And osteopathy is a wonderful way to help people who've had a nasty experience where they've had a nasty jarring fall or they've tripped and pulled a shoulder. Osteopathy is a very gentle way to help ease out the strains of these problems. And so we do quite a lot of work helping these kind of strains in that population of people. And we do a lot of general maintenance osteopathy to help alleviate symptoms of arthritis in the spine and in the hip and peripheral joints and so forth, and to help with general muscular tightness.